Remember that video I sent you that Dr. Piratia talked about what they saw in their clinic with some of their patients? Most people, when you lose normal weight, like if you're just doing it naturally, you lose about 25% of lean muscle mass and then 75% of fat, right? That's usually like
The ratio, yeah.
the ratio, right? But if you're using GLP-1 drugs on their own, it sometimes can be up to 50-50, which is alarming because remember what I said earlier, like it's not about a target weight, it's actually just about reducing your fat, as much fat as possible, having as much lean body, as much lean muscle mass as possible. So that was one thing that I thought was very interesting. And the one thing he said, which you and I definitely agreed on when we were talking about this, was people need to use this as a tool to shed off, like kind of similar to what I experienced those first couple of weeks, shut off as much possible weight to start off with, but then you need to adjust, and also you need to hedge against that muscle mass stress by resistance training.
That's exactly what it is, right? So it needs to be the right person, right? Like it's obviously not, I don't think it's an approach for every single, person out there who's overweight.
Yeah, it shouldn't be a first line approach.
It's definitely not a first line approach. Yeah, I agree with that for sure. But more importantly, it comes down to like the counseling that comes with that, right? I think the people that have the best possible outcomes, to your point, are the ones who are making the right changes, right? The ones who understand that this is not like, a cure for obesity, right? Because it all depends on what was the cause of your obesity to begin with, right? Yeah. So have you addressed things like, what you're eating? Do you understand that you have to commit to a healthy diet? Have you potentially explored microbiome issues, right? Are you having issues with IBS? Is that being looked at, right? Are you going to the gym at all? And the gym is actually the biggest thing in all of this, because to your point, when I looked at the data initially and I saw that, 50% of it is muscle mass, I thought that was, almost a bit deceiving. You know what I mean? Because it's like, okay, you've lost all this weight, but it's muscle, right? Exactly. What kind of weight are you losing, right? And so I think the people that end up doing a lot better are the ones who actually change their behavior as well, right? So you're going to the gym so that you're maintaining that muscle, you're not losing muscle, and you're kind of shifting all the focus to kind of burning off the fat, not just losing muscle, right?
You need behavior modulation.
Exactly.